Hi, everybody. My name is Paul Gerard. I'm a student loan consultant, and I'm very pleased to be working with the American Dental Education Association, ADEA. And we'd like to welcome you to dental school and offer you this short presentation called an Entrance Interview Companion, some important information to help you about financing your dental education as you start your first year in dental school. We're going to cover a number of things in this short presentation. We're going to talk about costs for just a few minutes. We'll talk about smart budgeting and responsible borrowing and how that can help you many years from now when you're repaying your student loans. We'll talk about your student loan portfolio and the kind of loans you may see in your student loan portfolio that you'll be borrowing for dental school. We'll also talk about some things for you to keep on your radar, some things that may change over the course of your time in dental school. And we'll wrap this up with some action items, some things you can do while you're in dental school to help you do a better job of managing your student loans and some resources that will help you. We hope you're aware that as a financial aid recipient, you have what's called a financial aid budget or cost of attendance number, and that includes tuition and fees and allowance for books, supplies, and equipment, and various expenses, including medical insurance and room and board, living allowances, transportation expenses, etc. We'd encourage you to focus on what you can control in your financial aid budget and your cost of attendance. It's not unusual for those items to comprise about 30% or more of your budget. And the better job you do of controlling those things, that will help you keep your debt down and help keep your borrowing each year to a minimum. Never borrow more than you actually need. And even though you can borrow up to the full cost of attendance minus other financial aid you get, don't assume you're going to need that full amount. And we'd encourage you, strongly encourage you, to talk with your financial aid office before you take out private loans. There is a special primer on the difference between private loans and federal loans and some questions we'd like you to consider asking before you take out a private loan. We've got those on the ADEA website at adea.org. Simply look under the red ribbon section for information for currently enrolled students and residents, and you'll see that information there. So watch your borrowing, control in your budget what you have control over. Don't obsess about things you can't control, such as tuition, and never ever borrow more than you really need. Now, one of the reasons it's important to budget carefully is you don't want to force yourself into a repayment plan after dental school that you really don't want because of poor choices you made while you were in dental school. The easiest example of that is someone who uses their credit cards a lot and builds up a lot of consumer debt in dental school, gets out of dental school, and would like to be more aggressive on their student loans, but they can't do that because they have all this consumer debt at even higher rates that they need to get rid of. And in some cases, they end up getting into an extended plan for repayment of their student loans when they'd really rather pay it off faster, but they just can't do it because of their consumer debt. So don't force your hand by making poor choices in dental school. Consider borrowing under your budget and then take out more money later if you need to. You can always borrow up to the cost of attendance at your school. You want to work very carefully with the financial aid office to be sure you meet their deadlines, but see if you can get in under their budget and take out more money later only if you need it. And remember also to work carefully with the financial aid office because it's our understanding that if you return any loan funds that you don't need and you do it within 120 days of disbursement, you actually won't pay any fees on those loans. So very important to budget wisely, borrow responsibly. This should help you when you get out of dental school. Now, this is a list of some of the different loans you may have in your student loan portfolio when you graduate from dental school. The direct unsubsidized loan, also referred to by many folks as the direct unsubsidized Stafford. The direct plus, also referred to in some circles as the direct grad plus loan. And then at some universities or some dental schools, you may have access to what are called campus-based loans. And these are loans that are administered and awarded directly by the school. And for dental students, these can include health profession student loans, loans for disadvantaged students, and in some cases, schools will have their own loan funds that they can loan you that come once again directly from the school. Be sure you check with the financial aid office about the availability of campus-based loans and also about any kind of application deadlines. Some of you may end up with private loans. We've referenced those earlier. And once again, we'd encourage you to check out the primer on private loans at the adia.org site. Look in the red ribbon section under information for current students and residents. Now let's take a quick look in detail at the direct unsubsidized loan, once again, sometimes referred to as Federal Stafford. It's $40,500 per year. Some schools will prorate that amount higher based on the length of your financial aid budget each year. These direct unsub loans carry a fixed interest rate. The rate changes on new loans every year. And so you could get out of dental school with 4 different interest rates on your 4 different direct unsubsidized loans, assuming you took one out each year. The current rate as we're recording this in August of 2015 is 5.84%. That's a fixed interest rate for new loans dispersed on or after July 1, 2015. So again, the direct unsub loan you had this year is at 5.84, and that rate will never change. Direct unsubsidized loans have a 6-month grace period and multiple repayment options that you'll be learning about as you go through dental school, and that will be covered at your senior loan exit interview. And direct unsubsidized loans are eligible for forgiveness programs and the Public Service Loan Forgiveness Program, assuming you meet the eligibility requirements. And there's plenty of time for you to learn about the details of the forgiveness programs. Now the Direct Plus, also called the Grad Plus, this is a loan where you can borrow up to the cost of attendance less other aid, and we've already referenced that. So regardless of what your cost of attendance is, when you net out any other kind of financial aid you're receiving, including the direct unsubsidized loan, that's what you can borrow in a Direct Plus. Once again, a reminder, just because you can do that doesn't mean you have to. Direct Plus loans have a fixed interest rate. The rate changes on new loans every July 1, just like the case with direct unsubsidized loans. And the current rate during the 2015-16 academic year is 6.84%, and that rate is fixed. Notice it's 1 full point higher than the direct unsubsidized loan. Once again, we're recording this in August of 2015, so if you're taking out a Direct Plus this year, the rate would be 6.84%. Now, Direct Plus loans don't really have a grace period, but they have something that operates in a similar manner. You can call it a 6-month window period. It's actually a 6-month post-enrollment deferment, meaning these loans will come due about 6 months after you graduate, just like the direct unsubsidized loan. There are multiple repayment provisions and options that you have on Direct Plus loans that you have plenty of time to learn about before you graduate. And these loans are eligible for forgiveness and eligible for the Public Service Loan Forgiveness Program, assuming you meet the eligibility requirements. So once again, direct unsubsidized, Direct Plus, these are 2 loans that make up the bulk of many dental school graduates' portfolios. We know you'll be busy as a dental school student, but there's some things we think you should keep on your radar screen as you go through dental school. Certainly, the interest rates on any new direct unsubsidized and new Direct Plus loans you have to take out. Keep an eye out for those rate changes. This year, as we're recording this in August of 2015, this year the rates did drop from the prior year, but we certainly can't promise that that's going to happen again. So watch for the interest rates, and the financial aid office can help you with that. There are a number of what are called income-driven repayment plans. You may have heard of some of these: income-based repayment, known as IBR, and a newer version called pay-as-you-earn or pay. These are repayment plans designed for borrowers who, when they graduate, their income is much less than their debt. In other words, their debt exceeds their income and they cannot afford repayment under plans such as a standard 10-year plan. There are likely going to be some changes to those income-driven repayment plans. Work carefully with the financial aid office to be sure you know what those are in case you need an income-driven repayment plan when you graduate. There may also be some changes, and likely will be some changes, to the forgiveness provisions, including to the public service loan forgiveness program. So once again, these are 3 things to keep on your radar screen and to lean on the professionals in the financial aid office to help you with as you go through dental school. Now, we close this short presentation with some action items and resources to help you. We hope you'll take a look at the AAMC ADIA Dental Loan Organizer and Calculator at aamc.org/godental. This terrific tool will help you do a better job of managing your student loans and will help you project what you're going to be looking at in terms of repayment when you graduate. You can also tailor this based on, are you thinking about a residency program, and you can also tailor this based on what you think your projected salary may be. So this is a terrific tool we'd encourage you to take a look at. This tool will also give you projected forgiveness amounts if you happen to qualify for one of the forgiveness programs. We have in red there, plan to pay back what you borrow. This will give you a really good idea about what kind of repayment you're looking at. And we think once you see some of the numbers, this will help you make the decision that you may face when you graduate about whether or not you lean on the federal government for help with a forgiveness program, or whether you take control of your debt and you pay it back as aggressively as you can. And that's why we have in there, whatever you borrow now, borrow responsibly, plan to pay it back when you graduate. We encourage you also to develop and stick to a budget. We've talked about that in an earlier slide. And always keep your contact information current with your loan servicer. This is the organization contracted by the U.S. Department of Education to help you in repayment and to help you manage your student loans. Now, a quick look at some websites that may be beneficial to you. The National Student Loan Data System, you may be familiar with this. This is the federal database of all the loans, such as the Federal Direct Unsub and Federal Direct Plus you may take out in dental school. And any loans you had from undergraduate and/or post-bac programs should also be listed there. We just talked about the AAMC ADIA Dental Loan Organizer and Calculator that we call DLOC at aamc.org/godental. And once again, you can upload your record from NSLDS right into that site. We encourage you to be sure you register with your loan servicer and their website so that you can actually manage your federal student loans there. These are organizations you should be familiar with, such as Fed Loan Servicing, Great Lakes, Navient, formerly Sallie Mae, and Nelnet. These tend to be the big 4. There may be some others that you have other loans with, but in all likelihood, your loans are serviced by one of those loan servicers. And then federal student aid at studentloans.gov, some great information for you there. So we hope these resources will help you as you go through dental school, help you do a better job of managing your student loans. Thank you for your time with this presentation. We hope that the information is helpful to you. And on behalf of ADIA, we wish you nothing but the best success in dental school and your dental career.